So good morning, my name is Nida and I'm the Physician Associate seeing you today. Can I confirm your name and date of birth? Great, so Mr. Khan, what can I do for you today? So you've been experiencing some pain in your left leg, is that right? And when did the pain start? So it started last week. Were you playing any sports or did you injure yourself when it happened? No? Okay, and has the pain been better since or has it gotten worse? So did the pain come on gradually or suddenly? Has it been continuous or does it come and go? So it's not gotten any better, it's gradually gotten worse and it came on suddenly and this pain seems to be constant, is that right? So Mr. Khan, could you please point to where the pain is? So from your foot to your thigh, anywhere else? And is your right leg also in pain? No? Okay. So you said it started suddenly. Could you describe the pain that you're feeling? So you don't know how to describe it. Okay, it can be throbbing, shooting, a dull ache. Okay, so you don't know how to describe it, but it's just very painful. Is that right? Okay, and does it hurt more when you walk on it or move it? Yeah? Okay, and on a scale of 1 to 10, 1 being no pain, 10 being very painful, how painful is it? So about 8 to 9, so that's very painful indeed. Okay, and do you have any current medical problems, Mr. Khan? So you were diagnosed with atrial fibrillation, and how long ago was that? And what medication are you taking for it? So you were diagnosed 3 years ago and you're taking warfarin and beta blockers. Do you remember the name of the beta blockers by any chance? No? That's fine. Sorry, what was that? So you've not been taking your warfarin regularly? And why is that? And how long have you not been taking your warfarin for? Okay, and did you consult a doctor before you stopped? Okay, so you stopped taking your warfarin for about 4 or 5 months. Okay, and do you have any known allergies? No? Okay, do you have any family history of heart diseases or circulatory problems? No? And if you wouldn't mind, I would like to examine your leg now, if that's okay. So if you could lay down on the bed and remove your from your waist down, so just your trousers please, that would be great. As well as physically examining your leg, I'm also going to be using this small machine called a Doppler ultrasound to measure the amount of blood flow through your arteries in your leg. Is that okay? Brilliant. Okay, Mr. Khan, thank you. We're all done now. So in your affected left leg, you're experiencing pain, as you've described. There is some numbness near your toes. Your skin is colder and more paler than the right leg, and you're struggling to wiggle your toes. There is also decreased blood flow to your left leg as well. So basically, based on the examination of your leg and your medical history, I am concerned you may be experiencing something called acute limb ischemia. Now, this is when there is something blocking off the blood supply to your limbs, and in your case, it is your leg. So with your current health condition of atrial fibrillation, as well as the fact that you have stopped taking your warfarin, this can increase your chances of getting acute limb ischemia. So the signs and symptoms of your leg are in keeping with the 6 P's, which are signs of acute limb ischemia, which are, like I said, I went through your symptoms. So it's pain, pulselessness, pallor, so your leg is paler, paresthesia, which is tingling, so earlier you said it felt like pins and needles while I was examining you. Perishing cold, so it's cold to touch, as well as paralysis, which can be seen in your toes at the moment. So, who have you come with today, Mr. Khan? So your wife is in the waiting area and she drove you here today. Okay, so what I'm going to do is I'm going to send you an urgent hospital referral. It is important you're seen to as soon as possible by a specialist so they're able to assess your leg. So do you have any questions for me? Okay, so to answer your first question, which was how would stopping the warfarin and having atrial fibrillation cause an acute limb ischemia? Okay, so Mr. Khan, you have the condition atrial fibrillation and you were given warfarin and beta blockers. So the warfarin is a blood thinner which allows the blood to move easier through the body, which means it's less likely to form a dangerous blood clot. So I can see you're nodding your head, so you were told this before as well. Is that right? Yeah, okay. So there is a chance that because you stopped taking the warfarin about 4 or 5 months ago, that a blood clot may have formed and is currently reducing the blood flow to your left leg, which is why you're experiencing a lot of pain and the signs that I went through. So your second question was if something else may have caused it. So there are risk factors which include smoking, diabetes, obesity. However, not everyone would have risk factors. Acute limb ischemia can result from the formation of a blood clot or an embolism, which is when, and so an embolism is when a blood clot travels around and gets stuck in a blood vessel, or trauma during surgery. So these three things can cause blood flow to significantly reduce or stop altogether in a limb. So when you go to the hospital, they will assess you and confirm whether it is acute limb ischemia, and if it is, acute limb ischemia, they will run through treatment options with you. Okay, so if you make your way to the hospital straight away now, they will be expecting you. Okay? Okay, thank you for coming in, Mr. Khan. I will see you soon. Okay, so as I suspected acute limb ischemia, an emergency assessment by a vascular specialist was needed as soon as possible for Mr. Khan. So when he goes to the hospital, they will determine the type of occultation and confirm if it is a thrombus or an embolism. They will find out the location of the occultation, duration of ischemia, neurological deficits and comorbidities. The specialist will begin assessing the viability of the limb by using a staging system. So stage 1 is viable limb, which is not immediately threatened. Stage 2A is marginally threatened. Stage 2B is immediately threatened, and stage 3, which is irreversible damage. So from then, they will begin to treat Mr. Khan and discuss treatment options whilst taking into account risks of treatment and the viability of the limb. Interventions may be endovascular therapies such as percutaneous catheter-directed thrombolytic therapy and percutaneous mechanical thrombus extraction, or surgical interventions such as surgical thromboembolectomy, bypass surgery, and in extreme cases amputation if the limb is unsalvageable. And this is why it is imperative that if a patient does come in with acute limb ischemia, that they are seen to as soon as possible.